Although every mother hopes for a gentle, quiet and peaceful birth for their baby, the truth can sometimes be very different. With caesareans, ventouses, forceps and long protracted labours, babies can sometimes appear unsettled following their birth. They may cry for long periods, refusing to feed and be generally grouchy. Many parents have found that a few treatments of cranial osteopathy can relieve their baby's tensions. Sometimes babies' bodies are pulled out of alignment during the birth, and through gentle manipulations, cranial visceral osteopath Lynn Bridgeford helps to realign them.
I think with babies you really got to look at them as a whole, and the fact that they've gone through this incredible journey, whether it's been easy or not, they've gone through an incredible journey from one medium into another, and it's, it's a big scary thing.
10-week-old baby Reuben has been treated by Lynn since he was born. He had been a very unhappy baby.
That's what he wants, a happy baby, isn't it? Yeah.
Mm-hmm. He was induced, so it all happened quite quickly, and it was very, very painful, and it was more traumatic than my first birth that I had, which was more natural. And the cord was round his neck when he came out. So basically that led me to think that maybe he had some sort of trauma, so that's why I came to Lynn.
He was crying a lot, very disturbed, very wriggly when I first saw him, and I managed to work with him and get some release in his body, but I didn't manage to get to his head, and I respect with babies, if they don't want their head touched, then you can do a lot by working on the body first.
Although Lynn wants to work on Reuben's head later in the session, she starts by releasing some tensions in the body.
Ooh, feels a bit funny sometimes when it releases, doesn't it? Yeah, some releases you get a bit...
Very often what I'll be working with babies is membrane, because it has memory. If you have a stocking on that's twisted, that feels all day, it pulls. That membrane feels like that for a baby.
Lynn works on Reuben's chest in order to assist his breathing.
Because we're talking about that
But when she moves further up towards his neck, where the cord had been, Reuben becomes visibly agitated.
He never likes having that done, does he?
I very much doubt whether it's pain, because I'm touching so gently. Having had the cord around the neck, very often it can be a memory from the birth, because it's not a pain kind of cry, it's like, oh dear. And whenever we've gone anywhere near there, I just do a little bit each time. He kind of tells us that it's upsetting, but it's not a painful thing.
Finally, Lynn starts working on Reuben's head. Very little pressure is applied as she starts to manipulate the membranes covering the skull. Rachel and Matt are convinced that cranial osteopathy really helped Reuben.
He seems to be a lot better. He sleeps a lot more in the day than what he ever did before. And he used to have crying fits as well, and he only has like 1 or 2 of them a week, whereas he was having them every day.
Like Reuben, other babies have benefited from cranial osteopathy. This is Kai. He's 17 months old. Following his birth, he wouldn't settle and kept his mum and dad up most nights.
He had come down quite roughly when he'd been delivered. He had quite a lot of compression in his neck and his collarbone, so the lady that looked at Kai actually looked at his whole body and didn't just do his head.
Michelle wanted to breastfeed Kai, but he found it hard to latch on. The cranial osteopathy helped with that too.
It definitely helps with problems to do with breastfeeding. You can get gentle adjustments made on their jaw, all sorts of things like that. So it helps them to open their mouths properly. I mean, Kai didn't open his mouth very wide at all until he had it done, and then after that he was gaping nice and big.
This is Jude, who is now 6.5 months old. His mum Sarah had experienced a long drawn-out labour, and following the birth, Jude was constantly agitated and cried a lot.
It was hell, absolute hell. The first 6 weeks, I probably had 4 or 5 hours really good sleep in that whole 6 weeks. He was feeding every hour and a half. When he did feed, he'd throw up. And she did 4 treatments on him, on his skull. And after the first treatment, it was incredible. It was like I brought a different child home.
Emma has also sought the help of a cranial osteopath after Evie was born.
She was 7 days old when she went to go and have some cranial osteopathy done, and she could never hold her head to the front. She always had it to the side, and after the very first session of having the cranial osteopathy, she held her head forward. and it was amazing. So after two sessions, she was fine.
Lynn sees this and other complementary therapies as the way ahead for better birthing.
I would like to see babies being worked on with osteopaths working with the mothers during delivery and with the babies as soon as possible. You know, with sensitivity and where it's wanted, but I think if we could walk around life without carrying those tensions around, we would all be a lot happier.
You don't think they've done anything until the child goes to sleep for hours afterwards. So in a way it's worth it just to get the extra rest.